Okay, now I am looking with the rigid one. Can you see these tissues?
Yeah.
These white plaques are the leukoplakia. In all urology world, we know these tissues, and everybody thinks they are curable with antibiotic treatment. And urology doctors try antibiotic treatment for this. Maybe in some patients they are cured, but certainly in some of them they stay here. Although you use many antibiotics in the last 4 years, this tissue didn't heal.
Yeah.
So we will fulgurate these tissues.
Is there too much of it?
Yeah, they are actually moderate. Look, there is the border of healthy tissue. This is a healthy tissue.
Yeah.
Here, the leukoplakia. They are not very widespread because you don't have the disease for a very long time. Mm-hmm. So compared to many other ladies, you have tissues here. They are unhealthy, but they are not very wide. Look, down below, you see the healthy tissue.
Yeah.
This is good. I see the healthy tissue here. But here, this is leukoplakia. Mm-hmm. We scrape it, and the healthy tissue comes out. It's very nice. It's a very superficial fulguration here. It's enough just to stop bleeding. Mm-hmm. Because in some ladies, when I scrape, I cannot get rid of the leukoplakia, so I have to fulgurate. But in your case, just scraping throws them away. It's good. Look, it's cleaned. The underneath the tissue is nice and healthy. But if I leave it, it will bleed like this.
Yeah.
So to stop the bleeding, I have to fulgurate. Of course, the longer we wait, the recovery is longer, and in younger patients and those who have the disease for a shorter time, we have very good results. Sometimes I have patients from other countries who are treated in other doctors, and sometimes the results are not good enough. It has a couple of reasons. First one is this instrument which I use, bipolar cautery or plasmic kinetic cautery, is the best one to treat. I tried lasers, holmium lasers, green light lasers, everything. But this is the best. The results are very nice with this instrument.
Yeah.
And you have to do enough fulguration because not only the leukoplakia, this is a normal bladder wall. This is healthy. But here still there is some red patchy tissues. We need to fulgurate them completely. These parts are easier. The difficult part is here in the bladder neck. Of course, we don't want to give any harm to this sphincter tissue, which holds the urine. But there is a part which you have to fulgurate in the entrance of urethra to bladder. So if we don't do it enough, the results are not enough. Mm-hmm. And these are the difficult parts, the bladder neck, which is barely visible. So experience is needed here. And I will check again with the flexible cystoscope to see if we performed enough fulguration here in the side walls and upper part of the bladder. Do you feel any pain now?
No.
Yes. You had spinal anesthesia,
Yeah.
which is you had an injection in your belly and you don't feel your legs and down body now.
No, I don't feel
Was
any-
it difficult? Was it painful?
No, it was. I thought it would be, but it was good.
Okay. So, in some hospitals, the anesthesia team is very experienced and do this spinal anesthesia very nicely. But some doctors don't like it too much, and I recommend to do what the anesthesia teams like to do. If they offer spinal, it is the best. And one of my advantage for spinal anesthesia, your body will be numb for 3 to 4 hours, which is the most difficult hours after the procedure. The first couple of hours after the procedure, there is too much irritation. And when you are numb at that hours, it's an advantage for us. You will feel nothing. If you have general anesthesia, when the procedure finish, it's too much irritating at first couple of hours. So with spinal, you will still be numb for a couple of hours and it will be comfortable. Okay, now I will empty the bladder and we'll see if there is any bleeding in the bladder walls, which is when the infection stays too long inside the bladder, the bladder walls become very fragile. I think the bladder flora, the normal bacterial flora of the bladder, is disturbed by this disease.
Yeah.
If there is bleeding in the bladder, the healing will be more difficult. So these are the fulgurated tissues. I am removing them, vacuuming them out. This is the orifice. It looks normal. Still there are some bleeders. So I am emptying the bladder now and checking if there will be any bleeding. There's an air bubble inside the bladder that comes from our instruments. I am vacuuming them out. Usually at that point, bleeders starts in the unhealthy bladders. You didn't have much of it yet. Only 1 point here, which is not too bad. I am emptying. Okay, so there is no bleeders in the bladder. Usually it bleeds mostly in the side walls. There are some little petechial bleedings, too less, not wide, which is good. Your bladder didn't bleed in my point of view, so it's good sign. We are expecting a good recovery. This is what we expected because you don't have the disease for a very long time. If you lose too much time with the treatments, sometimes the bladder becomes unhealthy. Okay, so this is the fulgurated part. These parts of the bladder are normal, healthy looking. The side walls are important and the upper part is important. Now I will check them with flexible cystoscope. Empty the bladder again. Look, there are some bleeders, not too much. This is not too bad. it's not bleeding, some pinpoint pathological points. So actually you had the disease for 4 years, which
Yeah.
is not only 1 or 2 years, you a certain amount of time. So if you were waited more, this would be too much bleeding and too much damage inside the bladder. This is not too much, but still you have some pathological bleedings. The rest of the bladder looks nice and healthy. With the flexible, and we do it all circumferentially, fulgurated the area. It's good, it's nice, and it's enough. Okay, in the left side it's a small point. I will fulgurate this part and we'll finish. Nice. So with the flexible, I controlled and I see that circumferentially we did every part enough, good. But in the left part there was a small area. I am like now searching for it. Okay, this one. I see this part is remained. Here it's good. Here it's good. So looking from another point of view is nicely showing us the missed parts. Okay, the rest is very nice. I am finishing. Good. I find enough tissues in the bladder. It was not extreme because your disease was not extreme. For a couple of months you were feeling better, right?
Yeah, yeah.
So the lesions were not extreme, but you had the lesions. And the most important part, your bladder didn't bleed it completely, only small points, which is also a good sign for you will have a nice healing.
Yeah.
So we will follow up and we will see. I will put the catheter for, today is Tuesday, I will remove it at Friday.
Okay.
We will keep it a couple of days. It's good, it's more healthy.
Yeah.
Your bladder will stay closed and will heal quicker.
Yeah.
And I will give you some medications in that period.
Okay, so do I need to go and get the medication from the pharmacy or
Yes.
you will? Okay.
Yes. Musa can help you on this.
Okay, thank you.
Okay.
And what time Friday?
Friday we will arrange it around 10 o'clock. I will say
Okay.
the exact time.
Okay, thank you so much.
See you at your room.
Thank you.